Welcome everyone to a really exciting Bridges event, the politics of OPS, Overdose Prevention Sites. I am Regina with Baltimore Harm Reduction Coalition. I'm a director of mobilization there. I'm also one of the organizing members of Bridges Coalition. I'm really excited to be here with many other organizing members of Bridges. And so we just want to, and we're really excited also to have, of course, our panel of these amazing public officials, politicians, politically inclined friends of OPS. So just as an overview, Bridges Coalition for Overdose Prevention Sites started in 2017, March of 2017. We are an advocacy coalition working to end overdose and criminalization by promoting safe spaces, dignity, health, and justice for people who use drugs. Our vision is kind of listed here in this image of community-run, mutual aid, grounding, social justice framework towards saving lives. And so we are working towards that vision because for us, it's not just that we want overdose prevention sites legally operating. That is a major part of it. At Bridges Coalition, we want to ensure, and we have to ensure, that these are community and peer-run spaces that are community-led. So, and if you have any questions about that vision or anything, Bridges holds various meetings and spaces where we can get into it more. So, moving forward, we are going to now take a moment because we cannot proceed without taking a moment of silence for our fearless harm reduction leader, William Glenn Miller Sr., otherwise known as a godfather of harm reduction in Baltimore and in Maryland. And so, and he passed away about exactly a week ago. And we know he touched everyone's heart. So let's take a moment of silence for him right now. Thank you, everyone. We are doing this event in honor of Mr. William Miller Sr. He was actually an instigator of this event. He called me almost every day to talk about how this event was going to go, how we need to ensure that Bridges leaders are part of it and that it's not, just more political talk, right? But really a conversation with our neighbors who are political figures. And so that is how we are leading this conversation. We are doing that in honor of our trailblazer, Mr. Miller Sr. I see that Council President Scott has entered our Facebook, or entered our Zoom room, so I'm going to admit him now. Hello, hello. We also have Ron here with me. Hello, Council President Scott. We are just going through an overview of this event, which is in honor of Mr. William Miller Sr. We're going to play some videos and everything. We are live on Facebook right now. I'm going to ask everyone we could go off video for now, and then we'll come back and do some questions. Okay, so Ricky and Ron, asking you to just go off video for now, just so that there's not too many beautiful faces to get distracted with. So Ron, this is Bridges for you folks. It's cool. All right, so next, an overview of what we are doing. An overview of what this event is for. Ron? Hi, can you just turn yourself off video for now? We'll come back to you, friend. It's like we're at a dinner table. This is Bridges. We're at the family dinner table. All right, so so this is to remind ourselves of the point of the event is that Bridges Coalition members will be in discussion with a group of amazing OPS supporters who work at the city, state, and federal levels of government. Baltimore County State Senator Shelly Hettleman, Baltimore City Council President Brandon Scott, and Democrat from Maryland's Congressional District 1, Mia Mason. But before we get into that, we would be remiss to not again honor our Bridges co-founder, William Glenn Miller Sr., who had for about 5 years of the OPS bill, the bill to authorize overdose prevention sites in Maryland. That bill had been presented to Maryland legislature for 5 years in a row, and he provided testimony, I believe, nearly every year. And so we're going to play one of those testimonies, and we can provide links to both of them online. But we are going to play this. If y'all just give me one moment as I get this together.
Only see one of you. Is there only one of the three of you? Because I'm not going to call your names again. Okay. Okay. So you Mr. Miller?
Yes, I am.
Excellent. You may begin.
Okay, my name is William Miller Sr. I'm the founder of Be More Power. I've been at this since the beginning. I'm also a board member of Communities United. I frequent several community organizations in Baltimore. I also was an active drug user for 51 years. This bill would save a lot of lives, but most of all, this bill would give the opportunity to parents to see their sons grow up, aunts to see their nieces and nephews grow up. You know, families to be whole. And this bill would heal a lot of those wounds that drug addiction causes, you know, and those things which most people fear when using certain services would be provided in this space. And this would be a space where people could feel comfortable about themselves, no stigma attached, no judgment, you know, but most of all, this bill would give people an opportunity to have a long and prosperous life, whether they use drugs or not, because people would be there to help them and there wouldn't be no deaths involved. But I would ask this committee to seriously think about passing this bill and think about the impact if you don't pass this bill. That's more deaths that's going to happen, and you have the opportunity to be part of that solution of stopping it. Thank you.
Thank you all for watching that amazing footage. We are so grateful, actually, to our Maryland legislature for having videos recorded like that. And we have to take on seniors' charge. So there is another, we will share the Senate hearing link at another time, but for time's sake, we're just going to keep moving forward. Just to say, what are overdose prevention sites? Senior described them perfectly, and we want to provide some text words for folks. This is the Bridges definition of overdose prevention sites. They are indoor spaces where individuals can come to consume their own drugs in the presence of trained professionals, including people who use drugs, people who are considered peers, outreach workers, etc., with immediate access to life-saving interventions, medical care, emotional support, and non-judgmental therapeutic relationships. OPS are not the solution. OPS do not replace treatment services. It is a crisis intervention. They are positioned within the continuum of care to reduce overdose rates. So often we hear, oh, we need treatment centers instead. We need this instead. We need to put money into cops instead. Well, we need all tools in the toolbox, and reducing and defunding attempts to focus on policing, right? But really instead funding support towards community-based solutions, such as overdose prevention sites, as well as many other. And there are over 100 OPS legally operating worldwide, and hundreds more operate without legal authority. We have to be honest about that. These are some locations, but I think the most important thing that we always stress is there have been 0 deaths. And the millions of visits that have occurred in these over 150 around the world for about 30 or so years, 0 fatal overdoses. That's miraculous. It's amazing. And it's because of community and love. Bridges members, just so we know, are who are organizations, also as individuals. And so these are a good couple dozen or members of the Bridges Coalition who are listed here, some of whom will be speaking today. And so this is our panel. I won't read out their bios because people already know. I know my face is like covering. We know that we have Council President Brandon Scott, who's a proud Baltimorean, who's also our Democratic nominee for mayor of Baltimore City. Senator Shelly Hettleman is a 11th district senator, and she has been the champion for the OPS bill for the past few years. And we have Mia Mason, who will provide a perspective around the federal government and the federal government's role in OPS. And questions to the panel will be posed by Bridges Coalition members representing the following organizations of the couple dozen who are part of Bridges. If your organization would like to join Bridges, please reach out. I'm now going to turn it over to my colleague, Alex Wilson, to ask the first question.
Hello, hello, hello. I hope everyone's doing well. And I just want to say I'm really happy to be in this space with everybody. So my question, the first question, just to get us started, could you please each share why you support overdose prevention sites? I do want to preface, we have about 10 minutes for this question. Thank you so much. And this is a question for everybody, for all our panelists, sorry.
Oh, I'm sorry, Alex. I didn't know if we wanted to go in a particular order. So I was like, I was just going to sit here and wait. But I guess I can start. And for me, it's really about trying to keep people alive, right? Since 2015 in Baltimore, we've had more than 3,500 fatal overdoses. And in my lifetime, and I talk about this a lot, we know that our city has looked at substance abuse the wrong way. They criminalized it, and that didn't work, right? People are still dying. Far too many people are still dying, and we know that OPSs help keep people alive, because we can never get to a point where we're getting people the help and services that they need if they're not here. So for me, it's very simple. We have to follow the best practices and models that have been helping to keep people alive across the world. And we know that OPS does that. And we have to understand that this is not something that should be a criminalized activity that we're going to focus and solve this through law enforcement. That has not worked. And when you know better, as my grandmother says, you do better. And what we have to do now is put things in place that allow us to keep people alive so that we can be better and growing and helping folks, as I often talk about, growing up in Park Heights and having to unlearn the culture that I was taught to look at folks who had addiction issues as less than human, and grow and evolve to a point now where I will fight for them and fight for OPS in every other way that we can reimagine how we're dealing with the issue of addiction in our communities.
Wonderful, thank you. I think my grandmother and your grandmother would be friends. She's got some great points. Mia Mason, would you like to answer why you support overdose prevention?
Sure. So harm reduction is super important. It allows us to, quote, end this war on drugs and basically stop the fight on the street for those who have to be able to use opioid to continue their daily life. It provides a safe haven for someone to actually be cognitive, because we treat them as a human. You know, it is something that we understand can be treated. And we have diagnosis for it. You know, it's that chemical dependency that is required every day for them in order to be fully functional. And it can happen at a young age, an old age, middle age, or it can just be something that the doctor prescribed and then the patient overtook it and then they're stuck with it for the rest of their life. So harm reduction is about helping the communities, regardless of their income, their race, their zip code, and actually providing them a safe haven and the opportunity to, you know, continue to be in our community. That's what I believe that harm reduction can do for us. And it's going to need assistance from the federal level to hopefully decriminalize things. And of course, you know, help the communities with grants.
Wonderful, thank you. And the floor is now yours. Please share, Ms. Hettleman, why you support overdose prevention sites.
Thank you so much. And thank you so much for having this really important discussion this afternoon. And thank you for all of your hard work. And again, my sympathies go out to everyone who knew Mr. Miller. It's very sad. There are too many people who have lost loved ones to overdoses. And I know people, and I'm sure we all do here. And we have not been doing everything we possibly can to address the issue. This year alone, our state budget directs more than $700 million to this issue. And people are still dying and still overdosing. And what we have done and what we're doing right now is just not enough. I see overdose prevention sites as another tool in the toolbox. And this is one that's evidence-based. It's been known to work in communities where they have them. And to me, it's employing a just multifaceted, multi-pronged approach that can save lives. We have done a lot of important work in this state. And we've broadened access to treatment. We've reined in provisions of prescription opioids. We have educational programs in our schools and elsewhere. We've expanded naloxone access and medication-assisted treatment. And all of these are really important tools in that toolbox I was talking about, but we can still do more. And I see overdose prevention sites as just another tool to help us address this issue. It's not going away. It is not improving, and we need everything at our hands to be able to address it. So I look forward to this conversation, and those are the important reasons why I support.
Thank you all so much for those really, really brilliant answers. I also, to echo your words, I'm very excited to be part of this panel and to hear what everybody's got to say. With that being said, I would like to turn it over to my friend, Ron Phillips, for the next question. Take it away, Ron.
You may need to unmute.
Yeah, I think you might be muted, Ron, but I did want to defer to you for the next question.
All right, thank you.
All you want.
Okay. Hi, I'm Ron Phillips with Be More Power. This question is directed to Senator Hettleman. And what are the benefits of advocating for a statewide bill to authorize OPS in the state of Maryland?
So let me tell you a little bit about the bill. The bill would authorize 6 sites around the state. And in order for that to happen, local communities would have to pair with the state health department. There would be community-based organizations that would establish sites, and they would have to do so in collaboration with the local community. So that community-based organization would work with the local health department and the state health department. And there would be 2 in urban areas, 2 in rural areas, and 2 in suburban areas. And they would also be focused in areas where there are substantial high incidence of drug use. And part of the beauty of a statewide program is that we would ensure oversight, and we would ensure that there isn't a concentration in urban areas, for example, that it would be dispersed throughout the state and everyone would have the opportunity to participate. Again, this is not a mandate at all. This is authorizing these local community organizations, along with their local health departments, along with the State Department, to voluntarily come together to do a program. So I think it's really important that the statewide bill sets out a framework through which local organizations can operate and work. And again, each community is different. So what is right for Baltimore County is maybe not right for Allegheny County. Even though we all have, and people in our communities are all struggling with these issues, it might look different compared in one area and another. And we want the locals to be able to have that flexibility and yet still set the policy statewide. I hope that answers your question.
And thank you for answering that. And I have another question, and that is, what is the biggest advice for an OPS advocate in Maryland? The biggest advice that you can give?
I think it's really important to learn about the legislative process is in the General Assembly. So this bill has been around for 5 years. My colleague from my district in Baltimore County, Delegate Dan Morheim, was the first person to introduce this bill before he left the legislature. And he's an emergency room physician, and he would tell me and the community about how he would see people in hospital emergency rooms every day. And a lot of them were there because of substance abuse issues. So what I want to tell advocates is it's really important to get to know your legislators. It's really important to get to know the legislative process. So when a bill is introduced, like I will introduce this bill again this year, it's going to be referred to a committee. In the House, it goes to the Health and Government Operations Committee. In the Senate, it goes to the Senate Finance Committee. It's really important to know who the members are of those committees and to reach out to them and to talk to them directly about why this issue is important to you. I would bet almost everything I had that everybody on each one of those committees knows somebody who's been personally affected by the issue, or they themselves may be personally affected. And so what it is going to them to make sure they really understand what the bill is about. Because honestly, and it's interesting that the title of this forum is The Politics of OPS. The politics of this issue really at times create so much misunderstanding about it. And so you have to tell them what is truth and fiction about the bill and about the issue. I'll tell you that 2 years ago in a couple of districts down in Baltimore County, postcards were distributed to a legislator who had to vote, was maybe going to vote on this issue that was totally false, totally fabricated about what the issue was about. It was alleging that like an ice cream truck was going to run through the communities giving drugs to kids, which was 100% false. But that's what my colleagues are nervous about hearing from by their opponents. And so I think it is incumbent upon each and every advocate, each and every bridge member coalition to go right to it, to directly talk to elected officials about the fact and the fiction and about why it's important and why it's going to save lives. And bottom line, that's what this is about, is protecting people's health and protecting people's lives. So I think those truths are best delivered by you guys and their constituents. So if you can help to educate the constituents of those members, that would be a tremendous, tremendous service that you guys could provide.
Oh, great deal. Appreciate it. And now we're going to turn this over to Ricky Morse of BHRC.
How y'all doing? How you doing? Good to see you again, President Council Scott. Earlier this year, we here at Bridges, we conducted a survey for the candidates for the primaries to see where they stand on OPS. and majority of the candidates were in support. With that in mind, President Council Scott, could you tell us, with that in mind, what do you think Baltimore City roles should play in advancing OPS?
Thank you. Thank you for that, Ricky. I think that, listen, I think that the city should play a leading role. And from our exploration into legislation related to OPS, it's clear that we're going to have to work with Senator Hettleman and the folks at the state. And there's a lot of work that has to be done on the grassroots level to lay the foundation for investments at the city level. And we know what the city can do. We can be on the cutting edge of fighting for something that we know works and we know will help Baltimoreans. But we do need to make sure that our residents understand what harm reduction is and why we can no longer criminalize people and look down upon people who have a addiction issue. We have to be honest. We know that we have a lot of work to getting people to understand that. The city and the city's leaders, starting with me, can be leaders in pushing that work and doing that work alongside with the members of the community. I'm sure we all see this work that each of us do in an important way. We have a long way to go to build that public understanding and fight against those reactionary tendencies that people have because they've been educated mistruths. And we know that Baltimore faces some of the deepest challenges. But that's exactly why we are well positioned to be on the cutting edge of the solutions. If we can build a model that works here in Baltimore, that the hope for what we can do across the state of Maryland is limitless. We have to be the folks who are pushing forward here in the city because we know we are the center place for where the issue is. And that's why you have my commitment that as the council president and as the future mayor of Baltimore City, we will push for this because it's the right thing to do and how we should move to dealing with this issue that's been plaguing Baltimore much of my lifetime.
Beautiful. Also, what would be your advice to supporters of OPS advocations?
Yeah, I mean, before I even answer that, I just want to say thank you to all of the advocates here in Baltimore and across the city, the Bridges Coalition, OSI, every resident, you, all the folks who, BHRC, all the folks who publicly stated they support this. That work matters. Your work matters. Having you come in and give my staff an orientation to overdose prevention and harm reduction, that's great work. Having to do that deep culture change work on every other level of city government is going to happen. And we're going to need your help with that education. We're going to need your support with our community association, with those who struggle to recognize that the way we've been trying to address this issue is not working, even though that should be clear to everyone. And at the local level, I would encourage you to get to know your council members. Lots of new members are going to be coming in. Sit and have those open and sometimes difficult conversations with them and continue to press on. Never give up. Never let anyone tell you that this is not the right way to go. We can do it as long as we stay organized, stay together, and stay unified.
Thank you so much. With that, I'm going to pass it on to Anya and Ye. On you.
You said it right, Ricky. Thank you. Thank you all for your responses so far. This question is for Ms. Mia Mason. Well, there are two questions, and the first one is, what role should the federal government play in OPS policy?
Okay, so to answer the first question, first I want to thank everybody for allowing me to be here with you to address what we can do on the federal level. There are bills that have been sitting in the House since 2018 and were introduced in 2019, and this directly affects, harm reduction, the opioid epidemic. Basically, it provides local substance relief programs to our communities through the state. So we would have to work with the governors, the senators, and the delegates, the city councils, in order to provide employees, provide medicines in order to prevent opioid overdoses. And then, of course, allow these grants to build the resources that are needed, including the infrastructure for the places for people to go to use on a regular basis, so that they don't have to worry about, you know, doing it in the streets, finding a place to stay real quick in order to do it, or do it at work. So on the federal level, we want to make sure that there's education going on and the training centers that go along with it. Because if we're going to hire anybody to help somebody inject themselves, to do it safely and make sure that they prevent an opioid epidemic from happening in our state, if we legalize this for the ops, we have to be able to make sure that those nurses and doctors are fully trained so that we don't lose a life. We've seen overseas that many have not had any deaths at all, just as we saw in the beginning of the presentation. We can have that not only here in Maryland, but also for the entire nation, so that we can end this opioid epidemic at its roots, you know, by allowing us to actually allow the folks who need it to use it safely, so that they can be fully functional human beings that can work, pay their taxes, and find a way to recovery. That's what we can honestly do to improve our communities from a national level.
I totally agree, and think that you know, we really are at a point to set an example for the entire country. And so my last question is the same as it was for all the others. What's your biggest piece of advice for advocates of OPS in Maryland?
Well, the best thing that anybody can do is simply get involved. We've heard excellent examples of how to do this. And the best thing that we can do is educate people. Tell people your story. Why are you supporting this? Find someone who may be in need. Find out who their friends are. Find out who their families are. Get them involved. Get them help that they need, so that we can get these programs online, so that when we go to the state legislators, when we go to our constituent spaces here in DC and the representatives that need to pass this, you actually have a group of people showing up as a coalition to persuade them and say, look, here's 5, 10, 20, 30 people out in the lobby that support this, and they're all from your district. Are you going to turn them away? That's the type of advocacy you need to do, and that requires you to stand up and bring everybody together, unite our communities. Our country is still divided, and we need to be able to heal that, and it starts right at the polls. So even if what we want has to go to a ballot measure, I think that's something that we need to listen to the people of our communities do in order to get this to be successful, not only in the state, but for the federal level as well.
Thank you so much. And with that, I'm going to pass it back to Reggie.
Thanks, Onyinye. This has been such a fruitful conversation, y'all. Thank you so much. I just am beaming over here. And we were joking earlier at Bridges about like, okay, we want to make sure they all have time. And we're like, you know what? They are political public figures. They are concise. They get through it quick. We are like 20 minutes ahead. So I'm throwing y'all some other questions. Get ready. And so we have, you know, something I think is on the mind of all of us. We really would love some advice on is really around the core of how can we ensure that we are collaborating at city, state, and federal levels. And I bring that up because as many of us know, in Philadelphia last year, I can bring up this, I want to call it a case study, but it's actually very vibrant right now. Philadelphia, the city of Philadelphia actually agreed, many public officials there agreed to move forward with an overdose prevention site. They called it, they had a different name for it there, but an overdose prevention site. There was a nonprofit organization ready to start it. The city said, let's go. The state of Pennsylvania said, we're not going to say anything or do anything. We're just going to be over here, but also kind of low key whisper how much we don't really want it, but we're not going to do anything. And then the federal government through the court system actually came in and said, no, this is not possible. The federal court said this actually goes against a old anti-Black racist statute called the crack house statute, that this goes against that federal law. So that was cases in the federal court, and it's just been this big battle. And that all is happening. The city actually pushed forward and won that case. The judge ruled in favor of Safe House, which is the organization that was going to run the OPS. Then we also have, as Jesse Dunleavy, one of our advocates in Anne Arundel County, mentioned in the Facebook comments on this event, there's also neighborhood resistance. So we're not only facing this federal government resistance, trying to use any approach to use court systems, funding issues, all of that to say, no, Philadelphia City, you can't have it. There's also very understandable, because as you all have mentioned, the resistance and culture shift is really required. There's neighborhood resistance, saying, no, we don't want this here, not in my backyard, various comments like that. So knowing about all of these pieces, I wanted to frame that and say, how can we kind of move forward with collaboration, positive collaboration between city, state, and federal agencies in moving forward with overdose prevention sites? This is open to all of you. Take a minute. Yeah.
Well, I'm going to go there and say that this election is really, really important,
Yeah.
right? We got 3 weeks, 20 days, right, left before November 3rd. It is really important to have a different federal administration in charge, right? That's ground zero. That's one. Two is, I really think it is important to have leaders at all levels of government who understand this and who are thoughtful about it and who will listen to the evidence and look at the experience. There's so much experience in the world on this that we can learn from. And it goes to crime reduction. There are studies that talk about how much is saved. I mean, $700 million is a big chunk of our budget. I'm not saying that all of that money, certainly not, should go to this, but investing, and it's not a huge investment in overdose prevention sites, would go towards saving money on crime reduction and in linking preventively people to other services in the community. So I think leadership is really important. In the city, it's really important. In the state, it's really important. And certainly at the federal government. Elections have consequences, as we all have seen so clearly in the last 4 years. So I think that's really important. And I think constantly getting out the word and getting out the research. I mean, we have wonderful researchers, Susan Sherman in this community, who's done amazing research about the evidence on how this has worked in other places and how it can work here, and the benefits, both for saving lives and for saving people and governments money on healthcare. So I think bottom line is you look at the data and it is our job, I think, as elected officials to educate the community. And so I think we have to constantly do that. And you have to have open lines of communication with folks on the ground, with the neighbors, again, this bill is not a mandate. Nobody's going to cite anything anywhere without local community support. So we just have to keep saying that over and over again, that this is just allowing, if there is support in the local community and in the local health department and, community-based organizations, that people are permitted to do it.
Thank you.
And I would just first start off by echoing the senator's sentiment. This election is the most important election in the history of this country. This time, it's not just something to say, right? It's the reality. Do you want a presidential administration that believes in following public health data or not? Do you want a presidential administration to actually think that people who are struggling with addiction should be treated like criminals or not? Like, this is what this is really boiling down to, and we have to understand that, because we cannot sit on the sidelines this time, because all of this work that we're doing, we know what another 4 years of an unhinged presidential term of an unhinged individual already will be like, right? When there is no re-election or any consequences for him personally. And then what we have to do is then, when we elect the right people, we actually have to do the tough work of holding them accountable to evolve in the way that they think, like many of us have already done. Working with our cities and our states and our local governments to make sure that we are pressuring them to say, hey, we are doing these things, and we not just don't want you just stay out of it. We want you to be involved in it in a positive way, to making federal policy open to helping this. Because when you talk about how much the federal government, and especially our folks in Congress and others, spend a lot of time talking about the world, right? And how the world is beating us and other countries are evolving and beating us in technology and all these other things. Well, they're doing it on how we're dealing with addiction too. And we have to pressure them to understanding that, and then doing that tough work of building those coalitions from the ground, through local government, through state government, through the federal government, so that we can do what's right, not just for Baltimore, for Maryland, but what's right for this country, and stop criminalizing, like you said, you're using the crack house statute for something that we know was racist to begin with, right? Like the whole crack cocaine. Well, if it's cocaine, it's okay. If it's crack, it's not, because it's black people. We have to break away with those outdated ways of thinking and challenge anyone that wants to still do it that way.
Well, like everybody else has said, the election matters. My running mantra is we are basically running to restore equity and equality. And you said, like, don't have it in my backyard. Well, honestly, it's your neighbor doing it. Honestly, it's the person across the street from it, 2 blocks down the way that might have an issue. So many people have lost their jobs, lost their health care, lost the will and hope. We're here to provide that change this November, to actually get something done in the next legislative cycle, to make that happen for the next decade of your life, to fix the problems. You've ended up in debt. You've ended up with medical bills. You've ended up with so much that you've turned away. And now you're thinking about ending it all. And you've decided to start using a drug. It is time to be cognizant about that and use it responsibly. We need to be able to provide those centers, if you go down that pathway, to bring you back, to bring you to that recovery point. Even if you are stuck using it for the rest of your life, understand that we want to be there because we are part of your community. We are your neighbor down the street. We are the neighbor who's across the road, finding out exactly what you're doing. And then when we say it's not supposed to be in our backyards, it's about going to your neighbor's door and checking on them, finding out what's wrong and trying to help them. The federal government can only do so much. But when you actually show up and talk to us and ask for something, we can work on it together to find a solution, even if it means reaching across the aisle and saying, hey, look, we all need to figure this out and get this done to make it work for us in the community. That's why we're trying to restore that equity and equality, because this affects everyone. Regardless of what your history is or where you grew up, it is a national problem. So many counties are going purple, and it's a benefit to see this. And so many coalitions are coming together to provide harm reduction, training, education, and get people certified so that we can open up ops programs and centers. We can't turn those away. We can't shut them down because of a stigma. We need to be able to look past that and stop judging people. Let's restore that equity and equality, and it starts with you this November.
Thank you all so much. I think what is something that's kind of rising for me right now in this conversation, I just want to hold up, is that, you know, we have so many perspectives here among you all that we hear across the gambit, really, to be honest, when we are talking with policymakers, right? We are talking about the economic perspectives and and people who are feeling, you know, the deeply harm reduction we know everyone's using, and you know, that is the space we're going to, and just ensuring people are healthy and safe, and a lot of folks who are moving towards, you know, how do we get folks connected to services, treatment, et cetera, right? So I appreciate all 3 of you for really bringing all of those perspectives and these you know, the different angles people come to as they get to support overdose prevention sites. Not everyone gets to that, as many roads to get to that landing of, okay, yes, overdose prevention sites are what we need. And so I think you all have really presented that. And I'm wondering, just as kind of closing statements, if you, and again, this is me throwing a question your way, thinking about talking to your peers, right? Your fellow state representatives, federal representatives, city representatives, thinking about talking to them, what would you say to them? What is maybe 1 or 2 talking points to get your peers on board with overdose prevention sites? Again, this is open to all of you.
Yeah, I guess I'll start on that one. For me, it's very simple. The way that they have dealt with addiction and overdose in Baltimore for the 36 years that I've been alive isn't working. And we can continue to try those outdated ways of criminalizing people, treating people like they're subhuman, all of these things that they've tried, or we can actually do things, evolve in our way of thinking and do things that have been proven to work across the world. It's that simple to me. We know the way that we've been doing it doesn't work. People are still dying in unacceptable numbers, right? We can change or we can still do it. Get on board with doing things in a different way, in a more righteous way, because it's the right thing to do and it works.
I think that one of the strongest things that people can do is just tell your story. When you go into their office and you got that 5 minutes, know what your bullet points are so that you can actually be locked toe in step and have that moral courage and provide that passion to that representative so they can actually understand your side of the story and why it's so important for us in the community. I think that's bottom line, the way to get through them, through the empathy, the sympathy, and the actual facts to tell them exactly what your story was because it's happened to you and to others.
I would just say, echo my colleagues here, use the evidence that we have out there. There are, over about 12 countries that host 150 plus overdose prevention sites around the world. I know one of them, Insight in Vancouver. In the 17-year history of that one, there hasn't been one overdose death. And crime in the 5-mile radius around that site has been reduced compared to crime in the rest of the city. I think that one of the things that I talk about is, remember actually a decade and a half ago when people were talking about free syringes, right? There was a hue and cry, oh my gosh, people are going to be shooting up left and right. And look at what that has done. And you don't even hear about it anymore because it's a given in terms of one of the best practices of public health and harm reduction, right? Clean needles. It hasn't resulted in people. It's resulted. We know people are using, and so they need to use safely. And this is another. Again, I hate to use this metaphor. I keep coming back to it, but it's not a panacea. But what we've been doing, like the council president said, hasn't been working, and we just need another tool in the toolbox. This is an issue that has continued and continued, and we have evidence-based research that shows us that OPS can be an effective way of decreasing substance use, and the data should be driving our policy decisions. What we're doing now isn't enough, and we need to take every step we can to save lives. And that's bottom line. This is about protecting people's health and saving lives.
Thank you so much. Any last words before we kind of close out with a couple other bridges related things?
I just would say thank you for having me. Thank you for the great work. Thank you for helping me grow and mature in my way of thinking. I look forward to working with each and every one of you to make this a reality so that we can begin the next phase of our work to keep people alive and help everyone in our great city, our state, and our country deal with addiction.
Thank you so much.
I echo that. Thank you so much. This is a really important public education tool that you're providing, and I'm just happy to participate and look forward to continuing our work in Annapolis this session. Thanks.
Thank you.
Thank you very much for having me. It's an honor to be here with such wonderful hosts who represent us. And you know what you have to do? You have to get us into the proper legislative systems so that we can help our communities. And that requires you to raise your voice and vote. Thank you.
Thank you, Ms. Mason. Well, I think this is a great time, everyone, to take a big breath. And since we do have some time, I'm going to play another video from our godfather, William Miller Sr. This is his testimony from the Senate hearing from earlier this year. If you give me a moment.
Good afternoon. My name is William Miller Sr. I'm from Be More Power. I'm a founder of Be More Power. I do outreach work in the communities in Baltimore. First, I'd just like to say that Baltimore isn't the only area that this epidemic is in. It's all over Maryland. And I didn't come here to ask you for anything except for the fact that, listen, people are dying, not just in Baltimore, but all through Maryland. And if you pass this bill, you save lives. You have an opportunity to be part of the solution and not allow the problem to continue, because when you reject things that work, that is what you're doing. You're allowing this to continue. There's too many people dying out there, and we sit around these tables and we make these decisions on other people's lives. I'm asking you to be just. If not, then guess what? You have to sleep with it, not me. Thank you.
Thank you.
You have to sleep with it, not me. And lastly, I'm just going to show some last things. Bridges Coalition has so many, we have such creative, amazing people in the coalition who have worked with us. I'm going to shout out to Aaliyah Robinson of Charm City Care Connection. They are a program manager there as well as a filmmaker, and they worked with us. I'm glad Ricky just popped in. Ricky is featured in this video series that we put out earlier this year or last year. I don't know. Time is a construct. It's a 6-video series on what will OPS offer Maryland. And we know OPS will offer health, safety, justice, and dignity. And so please check out these videos. They are on, they are accessible at baltimoreharmreduction.org/Bridges Coalition. Yep. And I'm asking all my co-facilitators, if you're still here with us, please pop your faces in, show your videos again. We want to thank everyone. Please, please rest, wash your hands, drink water, call a loved one, do all the things that keep you joyful and enjoying pleasure in life. You please also follow Bridges for OPS on Facebook, Instagram, and Twitter, #OPS Save Lives. As everyone is here, we just want to say again, thank you so much.
Thank
Go ahead
you,
and unmute
guys.
yourselves. Yes, thank you.
And we get ready to start.
Thank you again.
Thank you. All right. Have a good one, everyone. Bye.
Be safe, everybody.
See y'all at the Bridges meeting.